guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm doing another Kahoot, and we're going to be going over blood disorders. We're going to be going over different types of anemia, hemophilia, sickle cell disorder. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it, so go ahead and press that thumbs up button so you don't forget. Subscribe to my channel if you haven't done so already, and be sure to check out my website, nexusnursinginstitute.com. There, I have so many resources for students who have graduated, they're studying for their boards, and students that are currently in the nursing program. You can sign up for a part 1 or part 2 next generation NCLEX review session. You can sign up for a private tutoring session, and you can also sign up for audio lessons if you're currently in the program. So be sure to check that out. Again, it's www.nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, and of course, right here on YouTube. My handle is the same everywhere, Nexus Nursing. Now, without any further ado, let's get started. Blood disorders. Okay, first question. Which food would you recommend to the patient with iron deficiency anemia? Would it be apples? Would it be chicken breast? Would it be spinach? Or would it be cheese? Very good, spinach. So let's talk about this iron deficiency anemia. This is a type of anemia that's caused because the patient doesn't have enough iron. Well, why is iron important? Iron is needed for the development of hemoglobin. Well, why is hemoglobin important? Hemoglobin is what actually carries oxygen in the blood. In order for oxygen to go to the different tissues in your cell, it has to be carried in the blood. And not only carried in the blood, something like oxygen literally jumps on hemoglobin's back. So hemoglobin, that's part of the blood, can carry oxygen where it needs to go. So you don't have enough iron, you don't have enough hemoglobin. You don't have enough hemoglobin, you don't have enough oxygen carrying capacity. And every single tissue in your body needs oxygen to survive and function. Okay, now let's look at the other options. Apples, we love apples. Nothing's wrong with apples, but it's not high in iron, it's high in fiber. If you're constipated, go ahead and eat some apples. Make sure you eat it with the skin. Don't peel off the skin because that's what has the most fiber. But we're not talking about fiber, we're talking about iron. Chicken breast, we love chicken breast. It's high in protein, right? We need protein to build muscles. We need protein for wound healing, but we're not talking about protein. We're talking about iron. Remember, iron is what's important for the development of hemoglobin. And cheese, we love cheese. Nothing wrong with it. It's high in calcium. We love calcium. Calcium is good for the formation and strengthening and maintenance of what? Bones. But we're not talking about calcium, we're talking about iron. So foods high in iron are going to be your green leafy vegetables, such as spinach, okay? Which statement by the client indicates a need for further teaching about supplemental iron? Would it be, I should take my iron pills on an empty stomach for better absorption? I can take my iron pills with orange juice to help with absorption. I will take my iron pills with milk to avoid stomach upset, or it is normal for my stool to become dark when taking iron supplements. What do you guys think? Wow, most of you guys chose the wrong answer. You chose, I can take my iron pills with orange juice to help with absorption. Go back to the question. The question says, which statement by the client indicates a need for further teaching? That means which one's a wrong answer choice. Whenever something asks you which one needs further teaching, which one needs clarification, which one needs follow-up, which one would you question? What they're really asking you is which one is the wrong answer choice. And the wrong answer choice is I will take my iron pills with milk to avoid food upset. You better not. Why? Because calcium decreases the absorption of iron. When you take peds and you get a test question about parents coming in and you do a test on the patient and pediatric patient, it's, you know, it's an infant. Let me not say it's an infant. Let me say It's a toddler. It's a toddler. And um, their iron is low. What is one of the first questions you're going to ask? How much milk is your child drinking? Why? Because we understand that calcium decreases the absorption of iron, and there's lots of calcium in milk. So no, if you are already iron deficient, you're not going to be taking that iron supplement with milk. Why would you take it with milk when that milk is going to make you not absorb the iron the way you're supposed to? What you're going to do is take that iron on an empty stomach with no food, but you're going to take it with ascorbic acid. You're going to take it with vitamin C, something like orange juice, something like lemonade. Why? Because that ascorbic acid increases the absorption of iron. So I should take my iron pills on an empty stomach? True. I can take my iron pills with orange juice to help with absorption. True. It's normal for my stool to become dark when taking iron. Absolutely. Matter of fact, that's one of the things you have to teach a patient. Otherwise, they're going to freak out and stop taking their supplement. It's going to turn their stools very dark and it's constipating. So you have to teach that patient when they're taking iron, they need to drink lots of fluids. They need to eat lots of fiber and they need to exercise a lot. Why? We want to increase peristalsis in their system. Okay. Jamie says, my son's iron drops. Okay. So when it's children and they can't swallow pills, yes, it can be taken liquid form. And that's important too. If it's liquid form, what are you going to teach? You're going to teach the parents to give the iron through what? A straw, because it's staining. Just like it can stain your stool, it can stain the teeth that are, forming in that pediatric patient's mouth. So you're going to tell them to take it through a straw. Okay, place the following nursing interventions in the correct order of priority for a patient with thalassemia major. Here are the options. Administer chelation therapy as prescribed, assess the child's vital signs before and during blood transfusion, administer prescribed blood transfusion, and monitor for signs of fluid overload. So you guys who are in the Kahoot with me, what you're going to do is take your mouse and just move your answers to first, second, third, fourth in order of priority. Your patient has thalassemia major. What is the first nursing intervention? The second, the third, and the fourth. Put them in order of priority of what you would do for your patient. If you're on the live, just put the colors in order. What colors would you do first, second, third, and fourth? Only 5 people got this right. Let's talk about this. So, thalassemia major, guys, this is when the patient is not making enough hemoglobin. Okay. This is an autosomal recessive disorder. Professor D, do I have to know that? Absolutely. It's going to be a test question somewhere in your academic career. Don't say I didn't warn you. Something else you need to know, the people who are like at highest risk are people who come from the Mediterranean areas. All right. So that's what's going on with thalassemia major. What are you going to do? The first thing you're going to do, think about the nursing process. You have to get information before you can do anything else. So the first thing you're going to do is assess. Check your patient, get information, check their vital signs before and during the blood transfusion. You need to have a baseline. How are you going to know something's wrong with your patient or what you need to do if you don't have any information? So that's the first thing you're going to do, right? After you do that, you're going to go ahead and give the blood transfusion as prescribed, as ordered. All right. This patient is not making enough hemoglobin. They need hemoglobin. Remember, I told you hemoglobin is what carries oxygen in the blood. So you're going to go ahead and give the blood transfusion. And what are you going to do? You're going to monitor for symptoms of iron overload. Why? Because we don't want, if the patient has iron overload, that can cause serious, serious, serious damage to your organs like your liver, your spleen, right? We don't want those adverse effects. So while we're giving that transfusion, we're going to keep assessing and watching our patient, make sure they don't have any signs of fluid overload. And last, what are we going to do after we check them for fluid overload? We're going to correct it if there's an issue. We're going to provide chelation therapy as prescribed. What is that? That is a therapy that gets rid of all that excess iron. Because again, we don't want to cause damage to the patient's major organs. So we're going to assess them. give the blood transfusion as ordered. While we're giving them the transfusion, we're going to watch out for adverse effects such as iron overload. And then we're going to go ahead and correct that adverse effect if needed by giving that chelation therapy because we want to get rid of that excess iron. Okay? Just think about the nursing process. You're going to assess your patient first, come up with your nursing diagnosis, come up with your plan, then perform your nursing intervention and go back and evaluate, see if it worked. Select all that apply. Which of the following nursing interventions should the nurse include in the plan of care for thalassemia major? So we're still talking about the type of anemia where that patient does not make enough hemoglobin. Here are the options. Select all that apply. Administer blood transfusions as prescribed. Encourage a high iron diet to combat anemia. Monitor for signs and symptoms of infection. Administer chelation therapy as prescribed. Educate the family about genetic counseling, and monitor for signs of jaundice and organ enlargement. Again, your patient has thalassemia major. What nursing interventions would you include in caring for this patient? What do you mean, what's the answers? You have to tell me what the answer is. Stop trying to cheat, Martina. I see you. In my explanation of thalassemia major, I already gave you guys like 3 answers already. Come on, guys. All right, so let's talk about this. Administer blood transfusion as prescribed. Duh, the last slide we just did, the patient had thalassemia major. I told you what it was. I told you that this patient is going to need blood transfusions. Why? They're not making enough hemoglobin. Hemoglobin's needed to carry oxygen in the blood. This patient's going to be constantly getting blood transfusions. So you're going to go ahead and give the blood transfusions as ordered. I cannot believe 31 of you guys chose encourage a high iron diet to combat anemia. Did I tell you this patient has iron deficiency anemia? No, I told you they have thalassemia major. Those are 2 different types of anemia. In iron deficiency anemia, yes, you're going to teach a patient to eat foods high in iron because the problem is not having enough iron. But in thalassemia major, the problem is not having enough iron. The problem is not having enough hemoglobin. Matter of fact, because they don't have enough hemoglobin and they keep getting all of these blood transfusions, we are concerned about them getting too much iron from the blood transfusions. Remember in the last slide, I was telling you that's why we're giving them the chelation therapy to get rid of all that excess iron. So why in the world would we have this type of patient eat a diet high in iron? How does that make any sense? I need you guys to tell me on the live how that makes any sense. You guys are going to have to know the difference. Let me tell you something. The nursing program is not playing with you guys. You're going to have to know the difference between iron deficiency anemia, thalassemia major, megaloblastic anemia, and so forth, so on and so forth. Okay? So just to be clear, thalassemia major, the problem is not iron. Matter of fact, they're going to be getting too much iron from blood transfusion. So we're going to watch out for iron overload. The problem is not enough hemoglobin. Okay? And the way that that's treated is by multiple blood transfusions, and we're going to be watching out for excess iron. Okay? So no on high iron diet. How about monitor for signs and symptoms of infection? Absolutely. Why? Any patient that's anemic, we're going to be concerned about them getting sick, especially thalassemia major. Thalassemia major, we're concerned about all of that iron getting into the patient's organs. That patient's going to be immunocompromised. Plus all those blood transfusions that they're getting, guys, anything that's invasive increases your risk for infection. So if this type of patient is going to get multiple blood transfusions in order to live, don't you think they're going to be at risk for infection? Of course. Next, administer chelation therapy as prescribed. Yes, because we want to get rid of all that excess iron we expect to happen because of all of the blood transfusions. Educate the family about genetic counseling. Only 23 of you guys said yes, when in the last slide I was telling you about thalassemia major. One of those things I said was that this was an autosomal recessive disorder. This is a genetic disorder. So yes, you're going to have to do genetic counseling. And last, monitor for signs of jaundice and organ enlargement. Yep. Why? Because of all that iron. All that excess iron, where do you think it's going to want to go? Into the organs, such as the liver, such as the spleen. You're going to see lots of RBC breakdown. That RBC breakdown increases what? The bilirubin. That bilirubin causes what? The jaundice. It's a domino effect. And guys, this is why you really have to take pathophysiology seriously. Lots of students, you don't care until you're actually in a nursing program, but the classes to prepare you for the nursing program, like anatomy and physiology 1 and 2, the lab, pathophysiology, those classes are important because they're the foundation. That's what prepares you for these types of med-surg subjects. Take it very seriously, guys. You got to know the stuff. All right, moving on. True or false? Megaloblastic anemia is caused by a deficiency of vitamin B12 or folic acid. Is this true or is this false? True. So what happens in megaloblastic anemia, guys, is that the patient has all of these RBCs, that's their red blood cells, but they're abnormal. Okay? They're abnormal and they're missing either B12, folic acid, or both. All right? This is true. Select all that apply. Which of the following nursing interventions should be included in caring for the patient with megaloblastic anemia? Select all that apply. Here are your options. Administer B12 injections as prescribed. Encourage a diet rich in folic acid and vitamin B12. Monitor for neurological symptoms such as numbness or tingling. Advise the patient to limit the intake of green leafy vegetables. Assess for signs of fatigue and weakness. Educate the patient about taking oral iron supplements. What do you guys think? All right. So let's talk about it. Administer vitamin B12 as prescribed. Yes, because I just told you in the other slide, when it comes to megaloblastic anemia, patients either have low, they don't have enough vitamin B12, folic acid, or both. So yeah, we're going to replace that B12. Encourage a diet rich in folic acid. Again, yes, because they either are lacking one of them or both. Yes. Monitor for neurological symptoms such as a numbness or tingling. Absolutely. What can cause numbness and tingling? Numbness and tingling, those are neurological symptoms, right? The lack of vitamin B12. That causes neurological symptoms. And just by the way, guys, vitamin B12, if you are lacking vitamin B12 and it's not replaced, it's not a question of if, it's when. You will die, and you will die shortly. You cannot live without vitamin B12. So if you have vitamin B12 deficiency, it absolutely must be replaced. How about advising the patient to limit the intake of green leafy veggies? Absolutely not. I'm happy only 10 of you guys chose us. Green leafy veggies are important. Why? They increase folic acid. Remember, when it comes to megaloblastic anemia, one of the types of megaloblastic anemia is not having enough folic acid. So you're going to teach them to eat green leafy veggies to get the folic acid that they need. Assess for signs of fatigue and weakness. Absolutely. And matter of fact, fatigue and weakness, this is a common symptom we see across the board with all of the different types of anemias. Absolutely. Provide education about oral iron supplements. False. Why? That would be for iron deficiency anemia. Again, we're talking about megaloblastic anemia. Make sure you know the difference between megaloblastic, iron deficiency, thalassemia major. There are more. Select all that apply. Which of the following clinical manifestations should the nurse expect to see in megaloblastic anemia? Here are the options: glossitis, paresthesia, bradycardia, fatigue, pallor, jaundice. Your patient has megaloblastic anemia. What clinical manifestations, signs, and symptoms would you expect to see? Guys, please stop asking the co-host. I don't co-host on my Kahoots. Thank you. All right, let's talk about it. Glossitis. When it comes to glossitis, this is like the hallmark symptom for megaloblastic anemia. When you see glossitis, you should be thinking of megaloblastic anemia versus the other types of anemias, right? So this is inflamed tongue. It's very large. It's red. It's painful. And the reason the patient experiences this is from lack of vitamin B12. Paresthesia. We talked about this. I'm happy a lot of you guys chose paresthesia, numbness, tingling, all of those neurological symptoms. Again, lack of what? B12. Bradycardia, no. I'm happy only 15 people chose bradycardia. When it comes to, matter of fact, all of the anemias, if the patient, I want you to think about it. If they're anemic for whatever reason, they don't have enough hemoglobin in the blood for whatever reason, for different reasons, right? But remember, hemoglobin carries oxygen, which means don't have enough oxygen in the blood. What do you think the heart would do if you don't have enough oxygen? The heart rate's going to increase. If anything, we would see tachycardia because the heart's trying to compensate, trying to push out more oxygenated blood that the body just doesn't have, but it's still going to try, right? So we would have seen the opposite. Sarah, please stop requesting. I'm not co-hosting. Next, fatigue. Across the board, this is common for all anemias. The patient's going to be fatigued. Why? Lack of oxygen. Pallor. That's another one that we see across the board for the anemias. And of course, jaundice. That jaundice comes from that breakdown of the RBCs, the bilirubin increases, and you'll see jaundice. True or false? The two most common forms of megaloblastic anemia are pernicious anemia and folic acid deficiency. You guys should know this answer. I've said it to you like 3 times already. I didn't use the exact word. Very good. True. Pernicious anemia, you're not absorbing that vitamin B12, so your vitamin B12 is down, and folic acid deficiency. Absolutely. Very good. All right, put in order. A 10-year-old's admitted to your floor in sickle cell occlusive crisis. Prioritize your actions. What are you going to do? Here are your options. Provide the patient education on avoiding crisis triggers, administer oxygen as ordered, administer pain meds as ordered, start IV fluids to ensure hydration. Put in order of priority. First, second, third, fourth. What are you going to do? You guys are killing me on the live. Shame on you. Shame, shame, shame. If we were in Game of Thrones, I would have been walking you down that long corridor and have everybody say shame to you. Look at you. Only 2 people got this correct. All right. We're going to put our critical thinking caps on. and we're going to walk through what's going on with the patient to make sense of our nursing interventions. I'm not going to yell. I'm very calm. We have a patient that's been admitted to our floor in sickle cell occlusive crisis. I'm so happy. Thank you, Erixa. Erixa said I was thinking ABC. That's the problem. You're supposed to think ABC, but you are supposed to think critically. NCLEX wants to make sure that you're not going to try to be a robot, that you are able to think critically through this. And I'm telling you, you're going to get a question like this, and it's meant to trip you up. Let's think about this. I'm so happy you said that, because everybody else on the live, that's exactly what they did as well. So let me get this right. You have a patient that just came in sickle cell occlusive crisis. So what's happening here is those RBCs that are supposed to be nice and round so that they can flow through the vessel, right? And the oxygen can go where it's supposed to go. They're now occluding the vessel because they've done what? They've sickled up. So now, instead of being nice and round in this shape, they've sickle shaped, and they've done what? They've clumped up, and they are obstructing the vessel. What does that mean? That means oxygen cannot go where it needs to go. Let me repeat what I just said to you. Oxygen cannot go where it needs to go. The patient has the oxygen. The oxygen's in the hemoglobin, which is in the RBC. The problem is the RBC is not moving. So those of you who chose, give the patient oxygen. Where's the oxygen going to go? It's not moving. The first thing you're going to do is provide hydration, because the minute you give that patient fluids, what do fluids do? Fluids cause those sickled cells to turn back into round shape. It caused those sickle cells that were clumped up together to unclump, so that they can what? Start moving through the vessel again and carry that oxygen where it needs to go. The problem was never oxygen. The patient always had enough oxygen. The problem was that oxygen wasn't moving anywhere. So you could go ahead and give that patient as much oxygen as you want to. If those cells are still sickled, the oxygen's not moving. That's why you give that patient fluids first. You cause the RBCs to go back to round this shape, to unsickle, to unclump, so that they can move. Then you go ahead and give them oxygen. Why? Because once you give them oxygen, you know the oxygen is going to move freely the way it's supposed to. After that, you go ahead and you give your patient analgesics. And let me be specific. When we're talking about sickle cell, we're going to give them the strong stuff. They're going to get opioids. There are 5 conditions we do not play with pain. The patient's going to get the strong stuff, and pain's a priority. What are they? Sickle cell crisis, which is what our patient's experiencing right now, cancer, burns, myocardial infarction, and stones. Those 5. And last, we're going to educate. You always educate last. You're going to make sure your patient's safe first before you educate them about anything else. I know I said I wasn't going to yell, but I lied. Forgive me. You guys know I love you. Let's move on. All right. Select all that apply. Which of the following should the nurse include in the teaching plan to help prevent a sickle cell crisis? Maintain adequate hydration by drinking plenty of fluids. Avoid exposure to extreme temperatures, both hot and cold. Get vaccinated and promptly treat any signs of infection. Decrease smoking and alcohol use. Use compression stockings to improve circulation, in the legs. And take hydroxyurea as prescribed by the healthcare provider. Select all that applies. Mazrat, I'm going to wrap my hands around your neck and squeeze if you don't stop playing. Okay, let's talk about this. Maintain adequate hydration. Drink plenty of fluids. Everyone should have chosen this, right? One of the best ways to prevent sickle cell crisis is being adequately hydrated, because dehydration causes what? Yes, those cells To sickle and clump up. So you're going to teach that patient to always walk around with a water bottle and always sip on water. If they're exercising, if they're in the heat, they need to drink even more fluids. We need to avoid dehydration at all costs. Next, avoid exposure to extreme temperatures, both hot and cold. Absolutely. Hot, it makes sense because you're going to sweat, you can be dehydrated. But what about cold? Yes, that's an extreme as well. These type of patients, they need to stay away from high altitudes. They can't go skiing. Skiing is not for them. They're going to mess around and go into sickle cell crisis. Get vaccinated and properly treat any signs of infection. Why? Patients who have sickle cell are immunocompromised. They need to be the first ones in line getting their flu shot, pneumonia vaccine. They cannot afford to get sick. You got to teach them to stay away from large crowds, stay away from people who are unhealthy, people who are sick. They cannot afford to get any infections. I cannot believe 25 of you guys chose decrease smoking and alcohol use. Guys, on the live, tell me what word in that phrase, decrease smoking and alcohol use, what word made the entire option incorrect? Tell me in the live right now. Type it in. What word in decrease smoking and alcohol use makes the whole thing wrong? Thank you. Decrease. Decrease? You need to avoid smoking. Avoid alcohol. And even alcohol, excuse me, if it's adult, you can tell them they can have alcohol in moderation. But smoking, absolutely not. Under no circumstances. Never in the history of medicine, never in the history of nursing do we ever tell someone to, just slow down on the smoking. Smoke just a little less. No, what do we tell them? We tell them to avoid smoking. We tell them to what? Cease smoking. Stop completely. I want you to think about it, guys. Smoking causes vasoconstriction. Close your eyes and think about what's happening in the sickle cell patient. Imagine those RBCs that are sickled. Imagine those sickled RBCs that are clumped up, already obstructing the vessel. And then on top of that, you have vasoconstriction. Does that make any sense? Matter of fact, children who have sickle cell disease, because when you think about stroke, you always think about older patients who are at risk for strokes. But children who have sickle cell disorder are at risk for strokes. Why? Because when those cells sickle and clump up, it can what? Cause a rupture in a vessel and cause a stroke. So with that line of thinking, who would be safe to smoke? Nobody. So there's no slowdown or decreasing. Avoid smoking, period. What about use of compression stockings? Absolutely not. That's going to what? Decrease circulation. Decrease circulation in the patient that's already at risk for decreased circulation? No, we're not going to do that. And last, take hydroxyurea prescribed by the healthcare provider. Only 12 of you guys chose that, and it's true. This is a drug that helps to increase the fetal hemoglobin that does not sickle, right? So it's a treatment given for sickle cell crisis. So that is true. True or false? Thrombocytopenia is the overproduction of platelets to more than 450,000. Is this true or is this false? Very good. It's false. Break down the word. Thrombo, clots. What makes you clot? Platelets. Cyto, cells. What's the cell of clotting? Platelets. Penia, a little bit of. A little bit of your clotting cells. A little bit of what? Platelets. Your normal platelet count is 150,000 to 450,000. So if the patient had thrombocytopenia, they would have less than what? 150,000. Now, if you have more than 450,000, what's that called? Can you guys type in the live? If your platelet count is more than 450,000, what's that called? Thrombo, which is clot, cyto, Thrombocytosis. Very good. One person answered. Thrombocytosis. So thrombocytosis is having too many platelets over 450,000, and thrombocytopenia is not having enough platelets less than 150,000. All right, guys, one more slide to go. This type of hemophilia is the most common, and factor VIII is what's missing. What type of hemophilia are we talking about? A, L, K, or X? Very good. It's A. All the other letters I made up, guys. So this is a recessive trait. It's passed on from the mom to the male. Um, this is a bleeding disorder, right? So, and usually a patient will bleed in the joints. So this is a disorder where we care about safety. Safety is a big issue. This type of patient cannot play contact sports because they will bleed out internally. They can't play basketball, soccer. They better go play golf or bowling, something like that, but no contact sports. All right. So in hemophilia A, which is the most common type of hemophilia, what the clotting factor that's missing that's causing them to bleed so much is factor VIII. But also you guys need to know hemophilia B. With hemophilia B, the clotting factor that's missing is 9. So with B, clotting factor 9 is missing, and with A, which is the most common type, clotting factor 8 is missing. And again, you guys need to know that this is a recessive trait disorder. Okay. All right, guys, that is it. If you guys want to see more Kahoots on blood disorders, because there are lots more topics for us to cover, just go ahead and let me know in the live or in the comment section of the video. I will be more than happy to make more videos for you. With that being said, let's see how you guys did.